Hi, my name is Shelby Latona, and I'm with Prevent Blindness Wisconsin. Today, we're going to be going through Vision Milestones. Prevent Blindness Wisconsin is a nonprofit organization. Our office is located in downtown Milwaukee, but we do serve the entire state of Wisconsin. We work on both children and adult vision problems. Our goal is for every Wisconsin resident to have healthy vision throughout their lifetime. As a parent or a caregiver for a young child, it's important to know that healthy vision plays a role in a variety of different things for that child. Healthy vision can contribute to improved quality of life and social interactions, ability to learn, self-esteem, athletic ability, and improved behavior in the classroom. Today, we're going to discuss the milestones that your child should be reaching in their first year of life. We're going to make sure that you understand how you can help your child reach those developmental milestones. We'll ensure that we review the signs of possible vision trouble in young children. We'll discuss common vision problems. We'll learn about children with special healthcare needs and the vision problems they may experience. And lastly, we'll discuss community resources. Moving into the vision milestones we would expect baby to be reaching from birth through around 1 month of age. Baby should be beginning to focus on objects, lights, and faces and following those objects. Baby should be focusing on those objects between 8 and 15 inches of distance. The first 6 weeks after a baby is born is a crucial time for their visual development. So at this time, you want to make sure that you're helping baby reach their vision milestones. You can do this by holding baby, looking at baby, and moving your head from side to side. Using a high contrast toy, something that's like black and white, holding that from about 8 to 15 inches and moving that toy from side to side. Or using something like a brightly colored plastic rattle, placing that rattle in baby's hand, shaking that rattle so that baby can hear that noise as well. When baby is between 2 to 3 months of age, we can expect that baby is able to notice their hands, baby is able to follow objects, lights, and faces at that near distance, and that baby is able to make eye contact with parents and caregivers. Baby should also have a social smile, be able to reach for objects and hold those objects in their hands. To help baby's vision at this age range, you can have baby lying flat on their back and moving their elbows in towards the midline. You can also make sure that you're playing with age-appropriate toys, taking those toys, placing them on one side, shaking or activating the toy to have baby look, and then moving to the other side to shake or activate that toy to bring the baby to the alternate side. When baby reaches 5 months of age, this is an important time in their visual development. We want to see that baby has a steady, straight gaze. So this means that their eyes do not turn in, out, up, or down, either intermittently, so some of the time, or constantly, which would be all of the time. It's very important by age 5 months for baby to have that steady, straight gaze. If at 5 months of age, we do notice that baby's eyes are wandering, drifting from side to side, we want to make sure baby is referred on for an eye exam by an eye care professional. At 5 months of age, baby also begins to see colors. So this is a great time to start reading colorful children's books and pointing out those pictures to baby. During the 6th month, we want to see that baby is purposefully reaching for objects and baby is able to follow objects both near and far. To help baby's vision at the 6th month, we want to place our toy close but just out of range, encouraging baby to reach forward and grasp that object. Of course, after baby does that, make sure you give baby the toy as a reward so they can play with it. By the 8th month, baby should be able to recognize parents and caregiver faces. Baby should also be able to focus on small objects like a raisin or a piece of cereal. To help baby recognize parents and caregivers, it can be beneficial to wear a brightly colored blouse or shirt and repeat that shirt every time you greet baby. You want to introduce yourself as you come up to baby and say, "Here comes mommy." It can also be helpful for parents and caregivers to have that repeated opportunity to be recognized. When holding baby, ask, "Where is mommy?" and give the baby a chance to look around the room and locate mommy. Providing lots of opportunities for that face-to-face interaction will help baby differentiate between faces and objects. It's also helpful for baby to look at their own face in a mirror and to play peekaboo. For the 11th month, baby should be able to look in a book and point to those pictures in the book. Baby should also be looking for small objects like a raisin when dropped into a container. To help baby reach these milestones, you want to look at a high contrast book with baby. So that means that the colors are very different from one another. If baby's not interested, maybe try another book. Sometimes they don't want to read that first book. Another option would be to take a block or a toy and drop it into a container. You can then ask baby where their toy went. Repeat that process, getting baby to then look into the container to see where that toy went. Vision milestones can vary by up to 6 weeks. However, if baby isn't reaching their milestones, we want to ensure that baby is being referred on to their pediatric primary healthcare provider so that they can be evaluated and an eye exam can be coordinated. They should also be referred to a birth to 3 intervention program. In order to make sure that your child has good, healthy vision, their eyes should be assessed by their primary care physician. This should begin at their newborn period and continue through all their well-child checks. Any of our high-risk children can be referred directly to an eye care professional. Next, I'd like to tell you about a wonderful community resource to help you find an eye doctor for your child. Infancy is a free eye exam with a participating optometrist during baby's first year of life. You can visit the website that you see on screen or call the phone number to find a participating eye doctor in your area. As a parent or caregiver, you'll want to pay attention to the ABCs, or appearance, behavior, and complaints of possible vision problems in children. Appearance signs, generally speaking, would be anything that seems a little bit off about the child's eyes. If they are red, swollen eyelids, if their eyes are clouded over or hazy, if we see unequal pupil sizes, so maybe a pupil is shaped like a teardrop or a pear. Of course, if we're noticing those eyes that are wandering, turning in, out, up, or down, and if we notice a drooping eyelid. Behavior signs can be things like rubbing their eyes frequently, squinting, frowning when they're trying to focus, or for some children with troubles with depth perception, they can frequently knock over their cup when they go to grab that because they don't understand where it is spatially. Lastly, complaints can be things like eye strain, fatigue, headaches, but when we're working with children this young, if they're born seeing this way, they assume that's normal, so they may not have any complaints. So like I just mentioned, most children assume that how they're seeing is how everyone sees in the world. So imagine if this is how you had to see everything. That would be really frustrating, but you wouldn't know that what you're seeing is different from everyone else. We're going to discuss common vision disorders in young children. The first 3 that we'll touch on are the refractive errors: myopia, hyperopia, and astigmatism. Then we'll get into strabismus and amblyopia. Myopia, or nearsightedness, means that you can see up close, but you're going to struggle to see in the distance. Like we see in this image here, the little boy on the swing is very clear, but the girl behind him is blurry. Now, with myopia, this is going to be pretty uncommon in our infants and toddlers. Generally speaking, we see children receive their first diagnosis of myopia between 8 and 12 years old, usually in the years around puberty. However, I want to make sure to mention myopia to you because we are experiencing a rapid growth of people in the United States developing myopia. We live in a very digital world and spend a lot of time in front of screens. Increased screen time has a correlation with developing myopia. We always want to encourage safe screen use that allows your eyes to take a nice little break and focus on something in the distance. Of course, with myopia, we can correct this with a pair of glasses, contacts, or whatever your eye doctor would recommend. Next, we have hyperopia, or farsightedness. So with farsightedness, the objects in the distance are clear and what's up close is blurry. So in this image, we can see that our little boy on the swing is blurry, but the girl in the background is very clear. With hyperopia, this condition usually starts in infancy, and a lot of children can actually outgrow their hyperopia by the time they're teenagers. Of course, to correct hyperopia, we will wear a pair of glasses or perhaps contacts. Lastly, we have an astigmatism. With an astigmatism, both near and distant objects are blurry. Astigmatisms are often caused by an uneven cornea. You can think of a normal cornea being shaped like a basketball or a soccer ball. The astigmatic cornea is shaped more like a football. So that irregular curvature is going to prevent our light rays from focusing on one spot on our retina, causing that blurred image. Astigmatisms are often inherited, so if you have an astigmatism, it's likely that your child could develop that astigmatism as well. We tend to see more complaints with an astigmatism like eye strain, fatigue, or headaches. And of course, to treat an astigmatism, the eye doctor could prescribe glasses, contacts, or whatever other option they feel is best. The next vision condition that we're going to discuss is strabismus, or a crossed eye. Strabismus affects about 2 to 3% of the preschool population. We want to catch it and treat it at an early age so that it doesn't lead to permanent vision problems, including permanent vision loss later down the line. Strabismus can have the eye turning in, out, up, or down. And it's also more common in children with neurodevelopmental disorders. In order to treat strabismus, we want the child to have a complete dilated eye exam to determine that best course of treatment. But treatment options can look like a simple pair of glasses to improve focusing and redirect that line of sight. Sometimes the glasses may involve prism lenses. It may include medication, including eye drops, which help the eye to relax and calm down those overactive eye muscles, or they may be surgery to correct those faulty muscle attachments in the eyes and straighten them out. The last vision condition that we're going to talk about is amblyopia, or lazy eye. Now, a lazy eye is an eye that isn't doing its job seeing. So what happens is each of your eyes sees an image that your brain puts together to see what everyone sees all of the time. With amblyopia, the eyes see such different images that the brain doesn't understand how to make them make sense. So what the brain does is it's going to suppress or kind of shut off one eye, doing all of the seeing out of the clear eye. So in this case, you can see that the left eye is very blurry, the right eye is very clear. So the brain is going to shut off that left eye, doing all of the seeing out of that clear right eye. Amblyopia is present in about 1 to 3% of the preschool population, but it is our most common cause of preventable vision loss in children. Amblyopia has a few different causes. It can be caused by an uncorrected refractive error, where one eye sees a more blurred image compared to the other eye. It can be caused by strabismus, or it can be caused by something blocking the eye, like a cataract that the child was born with. So to treat amblyopia, the first thing we need to do is correct the underlying vision problem. Whether that is just a simple pair of glasses for a refractive error, cataract removal surgery, muscle surgery for strabismus, whatever that underlying vision problem is, we need to correct that first. And then we need to retrain the brain. When we start retraining the brain, we are going to cover up the strong eye, forcing that weak eye to do the seeing. The most common way of doing this is an adhesive bandage patch therapy. In doing that, we wear the bandage patch over the strong eye, forcing that weak eye to do the seeing. We can also do this using drops. Essentially, those drops will blow your pupil really big, forcing you to not be able to see out of that eye, or an occlusive contact lens. The methods may vary based on what your eye doctor thinks is best for the child. However, we're always occluding that strong eye, forcing the weak eye to do the seeing. The patch can be worn for up to all waking hours, and it's very beneficial for children to do near work while patching. So things like practicing their letters, coloring, playing with dolls or trucks, those are all great things to do while a child is patching. Patching can take upwards of a year, but each patching story will be unique to each individual child. There are certain children who are at a higher risk for developing vision problems. These are children who have neurodevelopmental disorders, children who are born prematurely, and those who have readily recognizable eye abnormalities such as strabismus, that wandering eye, or ptosis, a drooped eyelid. Other risk factors include maternal smoking, alcohol or drug use, or a family history of vision problems. With neurodevelopmental disorders, a visual impairment can affect the child's ability to learn. In addition, there can be issues with speech and cognition. We want to make sure that we are identifying any of these possible vision problems so that early intervention can be made. Children with cerebral palsy are at a greater risk for developing refractive errors, strabismus, and amblyopia. They're also more likely to have issues with eye tracking and eye focusing skills. Children with Down syndrome are more likely to develop refractive errors, amblyopia, and strabismus. They're also more likely to suffer from poor eye focusing skills. Children with autism spectrum disorder are more likely to have refractive errors or strabismus and to also struggle with eye focusing skills. Children who are very sensitive to stimuli should be seen by an eye doctor who is trained to work with children. Children with attention deficit hyperactivity disorder are more likely to develop refractive errors. Children with a convergence insufficiency can sometimes be misdiagnosed as ADHD. Convergence insufficiency means that the eyes lose alignment when the child attempts to focus on a nearby object. Common signs of a convergence insufficiency would be blurred vision or double vision, which can then cause the child to become frustrated, lose interest with that object, and try to move on to something else, which is how we can end up with that misdiagnosis of ADHD. Being outside with your child has so many health benefits. When you're outside, we want to make sure that we are keeping your child's eyes safe and protected. Wearing sunglasses is just like putting sunscreen on for your eyes. We always want to make sure that the sunglasses we're buying are UVA and UVB approved glasses. You'll find a sticker in the corner of the lens when you purchase those glasses. When you're taking your baby outside, wearing a brimmed hat can be very beneficial to shield baby's eyes from the sun. The big important thing to remember is that cataracts and age-related macular degeneration, some of our more serious adult vision conditions, can develop due to exposure to the sun. If your child does not have vision insurance, Prevent Blindness Wisconsin has vision care vouchers. These vouchers are for an eye exam and a pair of glasses, or a replacement pair of glasses. There's simply one application, and Prevent Blindness Wisconsin will match you to the program that best fits your needs. You can find the application on our website or call the number to our office on the screen. So in conclusion, knowing your child's vision milestones is something to pay attention to as they grow and develop. There are a variety of different conditions that can have a vision problem as a comorbidity, so knowing your background and health history can help you make informed decisions regarding your child's vision health.